Hi guys, I'm going to do my checkoff for mouth cares and checking the pressure cuff. I don't have a mannequin, so I've got this little model. Styling, isn't he? Anyway, so bear with me. I have to use what I've got, I guess. So the first thing I'm going to do is check the order. And I'm going to check the patient's chart. I'm going to gather up all my equipment, and then I will go ahead and go into the room, introduce myself, tell Mr. Smith that I'm from respiratory care and I'm here to do some mouth cares on him, and then I'm going to make sure I wash my hands, glove up, and typically I'd be standing, but my video options here are kind of limited too, so I won't be going to video school. Anyway, so with that, I'm going to go ahead and go in and check the patient. I'm going to check his mouth, the inside of his mouth, his oral mucosa, his tongue, his teeth, just kind of make sure everything's good there. Check the placement of the ET tube and just look in there and check. The next thing I'm going to do is go ahead and suction him with this suction swab, and so go ahead and attach that to suction, go in around the ET tube, get on the edges of his cheeks and around the tube, trying not to displace it, get that cleaned out, get any debris if possible. Sometimes there gets to be a little stuff on their lips even, and you've kind of got the ability to get some of that stuff off of there. So that's that part. The second thing we're going to do is go ahead and attach the toothbrush to the suction, and I'll use this anti-plaque solution, and I'm going to go in there and get his teeth, get back good on each side. Again, trying not to displace the ET tube. And then from there, I will go ahead and put the catheter on, the disposable catheter, place it and suction down, and put that in until we hit resistance, and suction any other secretions or anything that might be in there, any drainage from what we've just done. Do that, and then the next thing I'm going to do is go ahead and take this swab and the mouth moisturizer, and I'm going to go ahead and try to moisten what we've just cleaned in his mouth, moisten that up, his lips, because obviously they can get dry as well. So moisten that up. Okay, at that point, I'm going to go ahead and he's done with that. We're going to want to do that as protocol, the hospital protocol says we should. And then I'm going to go ahead and check his cuff with the manometer. And so with this, I'm going to connect to the inlet port for his tube. And you can see on here, there's a green area right here. I'm going to check to see the pressure of that cuff. Now if we're going to want 20 to 25 milligram, or 20 to 25 millimeters of mercury, or 25 to 33 centimeters of water pressure. This, however, the green is 22 to 32 centimeters of water pressure. So we would just go ahead and make sure that that was where we wanted it. If it was not, it didn't have enough pressure, we'd put more pressure in there. If it was too high, then you'd push this here and release some pressure. So we got the optimal amount of pressure in there. And from there, I would check the patient again, reposition them if needed, see if there was anything they needed, and then I would go ahead and wash my hands, clean up any mess I have, and document the procedure. And then I would also let the nurse know if there was any issues that I encountered or anything that they need to be aware of. And that is that.